Welcome to Osteo Momentum. In this video, I will explain an easy and effective way to approach the differential diagnosis of elbow pain by dividing it into anatomical region. Elbow pain is a common complaint and it's often misdiagnosed. For a easier and more accurate diagnosis, the elbow can be anatomically divided into anterior, medial, lateral, and posterior. When evaluation pain on the anterior aspect of the elbow, it's important to consider two main conditions. First is a rupture of the biceps tendon. As a part of rupture of biceps tendon, patient experiencing pain, bruising, swelling in front of the elbow, mainly seen in bodybuilders and manual laborers. And also flexion of elbow, supination of the forearm is mainly restricted in rupture of biceps tendon. Also seen some poppy sign in rupture of biceps tendon condition. Next is the very common condition, that is elbow arthritis. We all know what is arthritis. It is a joint degeneration due to extra wear and tear on the surface of the joint. In elbow arthritis condition, the patient experiencing pain, stiffness and loss of motion in the elbow region. Normally, the person can move smoothly as the elbow, but if patient experiencing any arthritic pain, they can feel stiffness in the morning and also loss of range of motion. So when evaluating pain on anterior, two conditions: first, rupture of biceps tendon; second is elbow arthritis. Next is when evaluation of pain on the posterior aspect of the elbow, it's important to consider two main differential diagnoses. First is posterior impingement syndrome or valgus extension overload. This is mainly seen in athletes, shows this due to extended with loss of velocity and control. Clinical features include catching, locking, clicking and stiffness in the elbow. Tip of the OLECRANON is jammed into the fossa at the back of the elbow, causing many inflammation and cartilage damage. Next condition is OLECRANON bursitis or student's elbow. Commonly occur when students repeatedly rest their elbow on hard surface such as desk, causing irritation and swelling over the elbow. And this occur due to the inflammation onto the bursa that causing the OLECRANON bursitis, pain, swelling and sometimes loss of range of motion as mainly due to swelling and pain. Next, on to the lateral aspect. For the differential diagnosis of pain onto the lateral aspect, two main conditions. First is tennis elbow and second is radial tunnel syndrome. Tennis elbow is also known as lateral epicondylitis and it is mainly caused by the overuse of forearm muscles, especially the extensor carpi radialis brevis. It leads to pain, tenderness onto the outer side of the elbow, particularly during gripping or lifting activities. Cosen's Mills test is positive in tennis elbow, but in radial tunnel syndrome, this also showing the similar clinical features as such as in the tennis elbow. How to differentially diagnosis? While palpating the pain onto the tennis elbow, the patient complains of pain over the lateral epicondyle, but in the radial tunnel syndrome, it's slightly below the lateral epicondyle, and in the radial tunnel syndrome, it's a compression of the radial nerve, so it's showing some neurological involvement signs like tingling sensation, numbness, has more in radial tunnel syndrome as compared with tennis elbow. So on lateral aspect, first tennis elbow and second is radial tunnel syndrome. Don't forget to miss out radial tunnel syndrome also while complaints of pain on the lateral aspect. Next is evaluating the pain onto the medial aspect of the elbow. It's important to consider three main differential diagnoses. First is golfer's elbow. It's occurred due to overuse or repetitive strain of the wrist flexor muscles, especially flexor carpi radialis and pronator teres. Symptoms include pain and tenderness at the medial epicondyle, worsened with gripping, wrist flexion and forearm pronation. No numbness in golfer's elbow or medial epicondylitis. Next is cubital tunnel syndrome. The cubital tunnel syndrome is caused by the prolonged elbow flexion, pressure, or repetitive bending at the elbow. The location is mainly the ulnar nerve is compressed behind the medial epicondyle. So the location of the pain behind the medial epicondyle. Clinical features: pain, swelling, weakness of the hand, and decreasing the sensation in the medial 1.5 fingers, as due to the ulnar nerve passes through the cubital tunnel that is mainly compressed, as due to that feeling of numbness in the medial 1.5 fingers. And phalanx test is also positive in cubital tunnel syndrome. Next is medial collateral ligament injury. In medial collateral ligament injury is mainly occur in baseball players that due to the overhead activities and the valgus extension is increasing. This is also known as Tommy John injury, leading to chronic pain and lead to valgus instability, and the condition can be potentially disabling. For to evaluating the medial aspect of the pain, just consider the valgus instability and also assessing the carrying angle of the elbow joint. I hope this explanation helped you understand the cause of elbow and more easily. If you found it useful, don't forget to like, share and subscribe for more medical insights. Thanks for watching.